Welcome to our naplex prep series. Today, we're diving into the fascinating world of antibiotics, focusing on the mechanism of action of beta-lactams. This class of antibiotics is crucial in the fight against bacterial infections, and understanding how they work is essential for anyone preparing for the naplex. Beta-lactams, which include penicillins, cephalosporins, monobactams, and carbapenems, all share a common mechanism of action. They target the bacterial cell wall, a critical structure that maintains the bacteria's shape and protects it from the external environment. The bacterial cell wall is primarily composed of a substance called peptidoglycan, a mesh-like polymer that provides structural integrity. Beta-lactams work by inhibiting the final step in the synthesis of peptidoglycan. They do this by binding to penicillin-binding proteins, or PBPs, which are enzymes located on the bacterial cell membrane. These PBPs are responsible for cross-linking the peptidoglycan chains, essentially building the cell wall. When beta-lactams bind to these proteins, they block the activity of PBPs, preventing the formation of cross-links. As a result, the construction of a stable cell wall is halted. Without a properly formed cell wall, bacteria become vulnerable to changes in osmotic pressure. This leads to cell lysis, where the bacterial cell bursts, effectively killing the bacterium. Importantly, beta-lactams are bactericidal, meaning they kill bacteria rather than just inhibiting their growth. This makes them particularly effective in treating infections. However, the effectiveness of beta-lactam antibiotics is sometimes compromised by bacterial resistance mechanisms, such as the production of beta-lactamase enzymes. These enzymes can break down the beta-lactam ring, inactivating the antibiotic. To combat this, beta-lactamase inhibitors like clavulanic acid are often used in combination with beta-lactam antibiotics to enhance their efficacy. Understanding the mechanism of action of beta-lactams not only aids in your naplex preparation, but also helps you appreciate the strategic design behind antibiotic therapy. Keep this foundational knowledge in mind as you explore other classes of antibiotics. Thank you for joining us, and be sure to check out our other videos for more naplex prep content.